Professor Maher for this warm invitation. Moreover, thank you kindly, Professor Waleed, for the warm, hospitable welcome to our dear Anbar province. There's been a number of times that I've been to Anbar province in the past, and it fills me with great joy to see the advancements that we see, not just in the infrastructure, but in terms of advancing academia the way we see it in Anbar province as well. Now, there's going to be a program today, inshallah, with the theme of infectious diseases. I will kick off by arguing for the need of complementing existing experience in internal medicine by creating a dedicated speciality in the realms of infectious diseases and why that's important. And then my esteemed colleague, Professor Haytham, will tell us a little bit about his successful, absolutely tremendous milestones that they have reached in establishing, inshallah, the first run-through program of infectious diseases Iraqi board. And we endeavor in the future that Anbar province itself will be one of the centers for this. And then, of course, a very, very warm welcome to my dearest colleague, Dr. Nicholas Ray, who, despite all the predicaments happening within the Middle East, was still determined to come and visit Iraq, all of Iraq, a country the size of France, with much traveling, starting off from Basra, going to Nasiriyah, coming to Anbar, then Baghdad, then Mosul, and then back to Baghdad, inshallah, for safe travels. So it's a very warm welcome to Dr. Nicholas Ray on behalf of everyone. I'll give a brief overview of this, and then we have 20 minutes with Professor Haytham. Then we have 20 minutes with Dr. Nicholas Ray about the curriculum that they have in the UK. Of course, he's born and bred and trained up in that system. There have been changes with it, so he'll highlight some of that as well. And thereafter, we will finish off with a lecture on the approach to fever that is targeting higher undergraduate medical students, but inshallah, it will have much benefit for everyone. That will be half an hour, and then we'll open the avenue to myself and my co-chair to welcome comments or questions. So, I've put this title, and I was quite emotional, to be honest, when I put this title, because every time I plant a seed in Iraq that I see that with a bit of correct environment exposure from the sun, the soil, how much water you give it, and you see these roots coming out of the ground, looking into absolutely stunning trees, and hopefully in the future we will pluck those and reap those fruits that will be very tasty. And even if they're bitter at the beginning, we can make all the refinements necessary to make it something special in the future, inshallah. So this is a big milestone in Iraq, inshallah, the birth of the subspeciality of infectious diseases. And in a way, we were our own worst enemies in Iraq. The reason being is that infectious diseases is part and parcel of internal medicine in Iraq, whether we like it or not. That's the truth. And that, in a way, delayed the birth of infectious diseases, because as part of our internal medicine training in Iraq, we are expected to deal with a lot of infectious diseases. But I think, which is fine, and I think there's a lot of room for that still, but I think we need to go that other step to make it a higher speciality. So why do we need a dedicated speciality? So why do we need a dedicated speciality in infectious diseases? I've put this diagram, so you see we have this saying in the UK, نحكي عن البروفيربس بتاع دكتور ياسر. That's another one I said ذكرته. We say, jack of all trades, master of none. Which means that basically we can develop someone who is actually jack of all trades, then لازم يتدرب باطنية, they have to train internal medicine, master of one. And that's why the specialist has a bigger light bulb in their brain on the left-hand picture, and the generalist has a lot of cogwheeling. And you have to complement the two. You have to complement the two. You have to have an internal medicine component because inherently with infectious diseases, it has a wide variety of presentations that applies to all systems. So we need specialized expertise for complex infections, for resistance patterns, including multi-drug resistance, and emerging pathogens that we see in the future. You need specialist teams with centralized academic focus on that. And مثل ما نخيط خياطة tailoring, احنا نقول tailoring ليش؟ You need tailoring because that allows us to enhance patient outcomes. When you tailor treatment, when you minimize HAI, hospital-acquired infections, when you have effective infection prevention control, all of these things are tailored treatments, as you can see in the diagram, that requires all these expertise put together in a collegiate way in order to provide us with the positive outcomes that we desire. The birth of infectious diseases would allow true optimizing of the antimicrobial stewardship, الرقابة, supervision, to ensure prudent use to prevent resistance in the future and inform local guidelines. بعد احنا ليش ضالين معتمدين على guidelines from outside Iraq? We need guidelines within Iraq. I can't question or critique a colleague who has a very low threshold for starting everyone on meropenem and vancomycin, because in return they'll say to me, where are my reliable investigative modalities that have been calibrated appropriately? Where's the data to tell me what the resistance patterns are before you come back to me to tell me that I shouldn't be using or overusing or misusing meropenem and vancomycin? There's so much work to be done with this, and I'm hoping one central component is the birth of infectious diseases as a subspeciality. We've all lived it in our era when we faced a pandemic that brought the world literally to its knees. And we suffer from regular epidemics. We've had Crimean Congo hemorrhagic fever, for example, that Professor Haytham and many colleagues that we know, including some colleagues from Nasriya, have been instrumental in guiding sort of what we should do in such endemics. Managing outbreaks, guiding public health response, guiding state response to give them real data, real advice, is crucial if you have a dedicated team for that. And also, when you have a speciality such as infectious diseases, it becomes a lot more efficient in terms of resource allocation. State-funded institutions in Iraq probably look at $128 per head per year, compared against, for example, in the UK, it's about $7,000 $6,500 per head per year. So we're already struggling in terms of how much we can provide in state-funded institutions, and therefore resource efficacy within state-funded institutions or the second-tier healthcare system, where a lot of our patients spend out of pocket, means that we have to be careful about this so that we can reach the diagnosis. والطبيب شغله diagnosis at undergraduate level, postgraduate level. That's what you need. That's why we see how passionate we are when we make the diagnosis. Everything else will follow, whether it's treatment, guidelines, etc. That's why the art of medicine is how your ability to diagnose illnesses. So it will help admission avoidance. It will help streamline diagnostic pathways. For example, Dr. Yasser might say, no, this is sufficient. You don't need to do that extra test. You've already saved the patient. Why are we doing a screen for all of this when the likelihood of this infection is so low? Why don't we, if we're going to choose 3 out of 5, let's go for these ones. All of these things are more likely to happen when it's streamlined. Tailored disease treatment and monitoring. We have someone, for example, and Dr. Nick Ray will illustrate it later in his talk, with a particular infection, you come back with all the results, and then you home in to minimize the side effects for the patient by giving them something that will treat their underlying illness. فهذا جبت الضفدع شلون resource efficient اللي قاله ورقه هيك وحطها على مود يحمي نفسه من المطر هو ضفدع. And finally, before I give the podium, free the podium to Professor Haytham, is enhance multidisciplinary team collaboration. Infectious diseases, virology, microbiology, mycology, pharmacy, public health, specialist nursing teams in the context of, say, for example, chronic infections like HIV and so on. When you have an enhanced MDT collaborative effort, it doesn't have to be exactly the same models that we use in the Western world, but something similar where we have complex cases, even once a month, will make us provide something that is actually really worthwhile of focusing rather than a sort of haphazard عد الواحد دقيقتين ويا المريض يشوفها بالعيادة مثلا and they think that that's it. Some of these things require a good 20-minute discussion. حتى احنا we avoid unnecessary harm to the patient, and in the context of infectious diseases and public health awareness and the risk of spreading illnesses, it needs due effort and really important to put so much effort in at the beginning to contain whatever it is that is worrying you. And with that, I hand to my professor, my colleague and dear friend, Professor Haytham Al-Kubaisi, FRCP Edinburgh, to tell us a little bit about the new established run-through 5-year Iraqi Board Infectious Diseases. Shukran jazeelan.